The therapist places their hands on the side of the client's rib cage, just like this, and I ask her to take a deep breath in and let all of the air out, and as she exhales, I provide a little push to challenge the rib cage, and I ask her if she had discomfort. I've placed my client in a t-shirt that's split down the middle to facilitate me seeing her spine, and what I'm going to do is look at her spine as she bends over so that we can distinguish between a functional and a structural scoliosis. If a curve in the back is evident on standing and the client bends over and the curve straightens out, it is a functional scoliosis comprising mostly muscular tissue. However, if it does not straighten out, it's more likely called a structural scoliosis with a lot of bony involvement. So this is the way to look at it. Stand behind your client. I'll place my hands right here, and what I'll ask her to do is drop your chin to your chest, Heather, and slowly go over to pick up that imaginary pencil on the floor, and I'll ask you to stop right there to allow me to come down to the level of the spine. Stay right there, please. I can evaluate for one side being higher than the other, which indicates a rotoscoliosis. I can find the curve of the spine. If there is a curve, remember that scoliosis is indicated if it's more than a 10% deviation from the normal. So here we see a nice straight spine with not an indication of scoliosis. Slowly come back up, please. Placing fingers between the ribs is also extremely effective. Remember, the ribs are sloping down in this fashion. That's the angle of the ribs. So if I place 1, 2 fingers between the ribs and rock them back and forth, I can do some very nice intercostal work. You might even try 3 fingers if you choose. 1, 2, 3, cover them, and now we're treating between sets of 3 ribs. Nice, easy motion, finding the level of pressure that your client can comfortably take while you clear this area. Moving down to the next ribs, right. I'll change hands right there. And moving through it just like this. So we'll come in with the Dr. Raymond Nimmo beveled L-bar tool and come in at a 45-degree angle and work this direction and then in a scooping manner, just like that, to thoroughly soften the areas of the lamina groove and treat all of these little paraspinal muscles, the multifidus, the rotatories, and others that are in that groove all the way down. So we place the spine here just to indicate what we're going to be doing by placing it here at a 45-degree angle, working in this direction, and then scoop, 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 and work down the entire thoracic spine. We have the spinalis, longissimus, and iliocostalis thoracis. We even have the iliocostalis lumborum, not the quadratus lumborum, but the iliocostalis lumborum coming all the way up to the 7th rib. That's about right here. So we have literally 4 lines of muscle to be aware of. Spinalis, longissimus, iliocostalis, and about like that on this individual, the iliocostalis lumborum. So we want to be thorough. Getting between, there's the lamina groove, go over that. There's between spinalis and longissimus, go over again between longissimus and iliocostalis, and go over one more time and find the iliocostalis lumborum. And if I'm able to pull the scapula away enough, I can hopefully get the thumb saver in to treat serratus posterior superior. T1 through 4 coming out to this area, right underneath the scapula, right down in there, and you won't be able to get to it on every person. But if you can, there can be a wicked trigger point right down in here that gives rise to pain all the way down the arm. Dr. Travell tells us that a trigger point in the sternalis can give rise to a radiating pain in throughout the chest, covered by the area roughly by my hand right now. So we'll begin on the sternum, the entire length of it, down to the xiphoid process. Cautious down around the xiphoid. Cross fiber and with the fibers of sternalis. And then coming lateral just a bit to get the rib heads. First 7 ribs, the true ribs, are inserting on the sternum. Work cautiously, deliberately, to allow the client to accommodate what we're doing. And the other side. I'm working from one side to allow the camera to view what I'm doing. Ordinarily, I might go to the other side. But rib heads, here, here, and along here. Remember, we have the obliques. The obliques are attaching all along the rib cage that you see here. Each rib has a slip of the oblique attaching there. I'm rolling over the edge of the rib cage, and now I'm back on top. I could use a covered hand to treat each rib. There, there, there. I'm treating cross the body for the sake of the camera. Ordinarily, I would be over here treating, and then I would move around there to treat. But it's quite easy, having moved her to this side of the table, for me to treat her here. Be cautious in this area. And yes, use some skin rolling to warm up and loosen the area. How nice it is to lift the skin and the subcutaneous fascia all along the rib area below the xiphoid process. And now we'll do the right arm and the left leg together. Continue the breathing. Yes. Maintain it through another breath if you can. Now we're getting strengthening in through here and at the lower level on the left at the same time. Working both sides of the spine. And now the left arm and the right leg, please. Very nice. Full breath. Very nice. And then when you're ready, gently down to the table. A very nice way of strengthening the abdominals is the pelvic tilt or the crunch exercise, where we tilt the pelvis to press down the back on the table, just like that. Just like she curls her back to raise up her pubis and tighten her abdomen, exactly like that. And she can raise her head just a little bit, and that is a crunch. She's now tightening her abdominals. For an injured person, simply to raise the head for 20 seconds is a strengthening of the abdominals. With the knees up is just fine. We could ask her, with her head in a comfortable position, to simply raise both feet off the table by 1 inch, just 1 inch. That in itself right there is a strengthening for the abdominals. For the oblique muscles on either side, when she brings her arms up, she could bring them over here this way, just a bit, and stay only as long as she's ready to strengthen this side of the abdominals and the obliques. And she could come up and begin to strengthen the abdominals on this side very nicely. The reverse of that would be, instead of bringing her 2 knees up this way, she could bring them over that way, just a little lifting off the table. Just a little bit to strengthen, yes, these abdominals. And then down, and then lifting over this way, holding them in the air while she breathes very nicely and coming down when she's ready. The goal would be to get the person to strengthening the abdominals, which is so vital for problems of posture and in the pelvis and in the back itself, and certainly strengthening the extensors of the back, the erector spinae group. Notoriously weak in others, in everybody, we need to strengthen the extensors in order to improve posture, reduce pain, and increase flexibility and range of motion.